Counseling Officer in Center of Addiction Medicine, Sikkim. So today's topic for me was importance of mental health. Firstly, I want to define mental health. According to WHO, it is defined as a state of well-being that allows the people to realize their ability to cope up with their stress, to work productively, and also contribute to their community. So, importance of mental health. Nowadays, what we see is mental health is always lagging behind. Some kind of diseases, but when it comes to mental health, they hide it. They don't want to show up, they don't want to come and see the doctor. So, here today, I want to disseminate importance of mental health so that this video, I think it will reach out to some of the Am I audible? Hello? Am I audible to you all? Please, can anyone say that am I audible or not? Okay, so I was talking about mental health. Again, coming back to the first, starting from definition of mental health, it is defined as a state of well-being that allows people to realize their ability to cope up with the stress, to work productively, and to contribute something to their society. So my topic today was importance of mental health. So as we see that mental health is always lagging behind. Today also, when we have some kind of physical problems, we go and visit the doctor. But when it comes for mental health issues, we never come forward, isn't it? So here, what I want to say is that through this video, I think we can create awareness, we can provide information to those vulnerable groups who are in need or who are suffering in their daily life. So, mental health is as equally as physical health. An individual must know that mental health is as equally important as physical health. For example, if a person is suffering from depression, they will have increased risk of having heart stroke, heart diseases, diabetes. These all are the symptoms of diabetes. When the person is suffering physically, also mentally, they are disturbed. Mental health is an essential component. Okay, now the PPT is here. Actually, I have some kind of eyesight issues, so I might not read it properly through PPT. Ma'am, can you just show me the PPT? The PPT is not visible yet. Okay, so let me continue with the importance of mental health. This mental health is an essential component of health and well-being. It affects because mental health it affects the people how they think, how they feel, and ultimately how they act. So this illness extends to a serious mental health problems. See, when an individual is suffering from mental health issues, they don't seek help. They don't go to see the doctor, which in turn, which on a long term, what happens? They'll suffer from some kind of serious mental health issues like schizophrenia, personality disorder, and many more. So, most mental health problems are also driven by an extreme situation from their past. Like if a person is traumatized in the past, or if a person have a bad past, like if they have some kind of abuse in their past, family disputes, or any kind of divorce, such kind of issues will have a long-term effect on the mental health of an individual. So, mental health is not just related to the emotional and physical well being, but beyond that, see, for example, if we have an examination, when we are about to appear in university examination, when we are about to enter the examination hall, what we feel? We feel some kind of body ache, such kind of such kind of issues. So it's not just related with the emotional or physical well-being. It might also like acidity, body ache, headache, etc. These are the common symptoms. These are all stress-related symptoms which are seen in human beings. And this situation, what happens is it will further extend to hamper the behavior of an individual. Okay, behavior of an individual, which makes the person also socially distant. These are some of the symptoms which are easily seen in a person. As per science and medicine, there are various factors that can deteriorate individuals' mental health. These factors are classified under environmental factors. It might be because of the emotional factors or because of any physical factors or mental factors. In today's time, what we see is these emotional factors are the major drivers of negative emotion in individual. So the main cause here, what I feel is that the youngsters are being over pampered by their parents. Even in a school or colleges, they are not allowed to, the teachers are not allowed to scold, the teachers are not allowed to beat, or the teachers are not allowed to punish them, which has already made their emotional status very weak. So when once they are exposed to the reality, what happens is that when they're exposed to the reality, they can't cope up with those kind of stress, and ultimately their mental health deteriorates. And also, some youngsters they are quick to switch on to some kind of substance, suicide, etc. So these factors drives pessimistic thoughts in human beings. Thus, it is said that your body and your mind are influenced by anything and everything around you. So here, what it is said that it is your mind who is the driver. The mind is something that can control over your body. So what you think, how you feel, and how you act It all depends upon your mental status. A good mental health or a mentally healthy person will always have a better concentration, will always have a good relationship. The relationship will might be with your family, with your peer, with your colleagues, with your friends, anybody, isn't it? And they are more prone to have success in life. They have more self-confidence, they have lesser anxiety level, and they have proper sleep pattern. So these are uh, this is what a mentally healthy person shows. Next, mental health is important for foundation of emotional well-being, as is it contributes a sense of well-being and contentment and also life satisfaction. So finally, the PPT is here. This I have already completed. Ma'am, can you just skip those slide and show me? Can you please go forward? Yes, ma'am, here, ma'am, here. Ma'am, next to this slide. There is always a strong link between mental health and physical health. It is always said that a poor mental health can lead to increased risk of physical health problems. So mental health not just affects our physical health, but it also affects our behavior, our decision making process. Like if we are mentally unstable, if we are angry, how we act is aggressively. We act aggressively, and the decision which we make when we are not mentally healthy are poor decision, which won't lead anywhere, isn't it? So it enhances productivity and performance. A person who is mentally healthy will have a good productivity on their workplace, and they'll perform in a very well. Their performance level is very well as compared to the person who is mentally unhealthy. So it will allow the individual to concentrate, focus, and engage in productive activities. So recognizing the importance of mental health helps reducing stigma. So coming back to stigma, since long ago only there is issues which now has gone which now has decreased a bit, but still people have those kind of stigma where a mentally ill person are not treated well, like they are being discriminated from the society, they are not allowed to attend any kind of social functions, they are they are ignored by everybody, they are bullied by people, isn't it? So this recognizing the importance of mental health, it will help to reduce stigma. So how to recognize the importance of mental health is, we as a medical professional, we have the knowledge regarding mental health and its issues, but other person in the community, they won't have the knowledge regarding importance of mental health. So we are supposed to disseminate the knowledge. We are supposed to create awareness regarding mental health issues, the stigmatization, the discrimination. We should avoid those things. And also the treatment, we must explain them the treatment, how it can be treated, because those people, they think that mentally ill person are mad, they are psycho, they can't be treated. Some people also go to some kind of like tantric, they have some kind of myth, right? Like they are possessed by some kind of demons or something. So we must uh, avoid those kind of stigmas. For that, we must provide awareness regarding mental health issues. And this recognizing the importance of mental health, it will encourage more understanding and supportive society where the individual will feel comfortable to seek help. Here nowadays, what we see is people, if we have fever, we go to other places, we ask for medicine. We also tell them that, yeah, my daughter is having fever. But has somebody come up with saying like my daughter is having depression, my daughter is having anxiety, they never come up because of this fear, because of this stigma, because of the discrimination of the society. So, a mental importance of mental health will always facilitate a fulfilling life. Ultimately, a good mental health is a key to living a fulfilling and rewarding life. It enables the person to pursue his or her goals and navigate the life as per their wish. So, in 1959, WHO Expert Committee of Mental Health reviewed various definitions of mental health and observed that mental health is influenced by both biological and social factors. And here, what we see is these mental health conditions are not static conditions but are subjected to variation and fluctuation in degree. They are not stable, they won't be in one pace, the degree will always fluctuate. Many of us are very quick to look after when our physical health alignment deteriorates. As I already said you that when we have some kind of physical illness, we run to the doctor. But when we are anxious, when we get depressed, when we will have loss of appetite, loss of sleep, we never go and see the doctor because we fear, we feel shame to go and visit the psychiatrist, isn't it? So, but fewer people are willing to prioritize caring for their mental health. So now I want to talk about some of the principles which are also evidence-based to achieve optimum mental health. The first one, it is said to be nutrition. It is said that a person who eats healthy stays healthy, isn't it? So what we eat is ultimately going to uh, show in our body. So according to some of the research, what we have seen is that even in nutrition, the person who are fully 100% vegetarian have lesser mental health issues as compared to the person who are non-vegetarian. So, for obtaining optimum mental health, it is said that plant-based nutrition is very, very important. Second one is exercise. Exercise alone can have a great contribution on diminishing of symptoms like anxiety and depression. When you exercise, you generate endorphins, isn't it? It is a good neurochemical. When you exercise regularly, you generate neurotransmitters like dopamine, serotonin, which are all happy hormones, which will make you feel healthy. The third one is water. These are the principles uh, like everyone can follow. So that's why I'm telling you nutrition, water, exercise, nutrition, water, exercise. This may be new for some of us, but yes, these all are evidence based. Water, as we all know, 70% of our body is water. So I think I lost my screen. I'm so sorry. I don't know because of the network issue. It just disappeared. My screen just disappeared. Okay, so the third principle which I was talking about was water. 70%, as we all know that 70% of our body is made of water, where 8% of our brain are made of components that has water, perhaps more than we utilize. Okay, this is the water element which allows things whatever we consume, these nutrients are traveled to the brain through water. And it's seen that people who do not consume much water are much frustrated, have less clarity of mind. The next one is sunshine. Sunshine is also one of the principles to optimum mental health. How? Because it plays a very important role to reduce pain. And research shows that at least for 30 minutes, if you take a sun bath, you'll have a relaxing day. Also, you'll have a good sleep. Next is temperaments. Temperaments means to take abstinence from the lifestyle which you are living, like the lifestyle which are bad for your health, like to balance the lifestyle, to take abstinence from certain things, what we consume or our habits. If a person can control over his lifestyle and adapt to a good lifestyle, it can increase the livelihood. Next one is air. In here, I have a short, the research has shown something. I have a short story regarding air. In 1919, in Eukarya, California, a hospital was facing a great pandemic of flu, some kind of flu, and it was getting out of control. So, the chief medical officer, what he did, he called the army and asked for some tents, blankets, because they didn't have space inside the hospital. So the army people, they brought some kind of tents, some blankets, and they started operating their hospital outside. So after certain days, what they found was the patients who were inside the tents were taking the medical help inside the tents. The death rate was zero as compared to the person who are inside the hospital. So what the doctor felt that maybe because it is because of the improper ventilation. So what he did was he opened all the windows. He made a proper ventilation inside the hospital, and after a week, they saw that the death rate diminished. So it is like this is a small story like air. How we breathe, what we breathe. When we breathe oxygen, and it cleanses the blood. And the same blood, when it travels to the brain, it creates neurotransmitters, which will help the person to stay mentally healthy. Now the next one is rest. We live in such a society that we are very what we say outcome driven, isn't it? For us to be successful, we have to achieve a greater goal, or to achieve a greater position. We have lots of stress. We can't rest. It's in our thought that we can't rest. If we rest, we will lose, isn't it? Sometimes we push so much that we lack the amount of rest that is needed to our body. And here also, a research was conducted where 30 samples were taken, where 15 were in a control group and 15 were in an experimental group. And the control group people were allowed to sleep whole night, whereas the experimental group people were said to keep them awake for the whole night. And the next day, a critical thinking test was done where the results were compared, and where it was seen that the person who had slept for 8 hours at the night did better. And also the self-reported test showed that the person who did not sleep have a perception that they did it better, but what it shows was the did not only just have the perception that they performed better, but they were more confident on doing it. Whereas the samples who slept for 8 hours were less confident. They did it better, but they had a lower confidence level. So rest can give you mental clarity. And it is also seen that 20 percentage 20 percentage of according to WHO, it is seen that 20 percentage of people in world are suffered with mental health issues every year, and around 20 percentage of world children and adolescents have mental health issues, which starts from like before 14 years of age, and among them 46 percentage of mostly youngsters, they commit suicide every year due to mental health issues. So this these are some of the points which we should remember, like why mental health is so important for us, and why we should take care of our mental health, and how to take care of our mental health, isn't it? So, lastly, what I want to say is prioritizing your mental health. Prioritize your mental health, as your mind deserves as much as care as your body does. Thank you, Pannadhaima, Subhati Nursing College, the members who gave me the opportunity to be here and to discuss this topic. I'm really, really grateful. And
Thank you, Santoshi, for this giving lecture. Thank you so much for the coming, and I am next time also calling.